welcome to another edition of ZoeTV. And today we are going to be speaking with Rocco from Dispatch Health. And we love Dispatch Health.
Yes, we do.
So Rebecca has been the Phoenix Area Market Director for Dispatch and has over 25 years of healthcare experience in sales, business development, and physician network development and engagement. So welcome, Rebecca. We're so happy to have you on and to talk about what's new with Dispatch Health.
Great, thank you.
All right.
Rebecca, welcome. It's exciting to get you on. I think we've had a lot of new residents come on campus, and so it's important for them to kind of get some perspective of what you guys provide and offer our campus as a whole. So why don't you talk to us briefly about what Dispatch Health offers to our community as a whole, and maybe what specific services that you provide.
Right. So Dispatch Health is a mobile acute care provider. So we provide mobile urgent care. So it's not primary care. We won't come and see you like a primary care physician. We will, however, come to see you for urgent to mid-emergent episodes. So we actually utilize advanced practitioners. So they are nurse practitioners and physician's assistants. They are operating at the top of their scope. They come along as a team with one of our Dispatch Health trained EMTs. They're called DHMTs. So there's always two people on site with you as a patient. We have very broad clinical capabilities. We can do anything that you would have done in a standing urgent care environment right there in the convenience of your home. Do you want me, we can go into some of the clinical capabilities and how you contact us. So first of all, the best way to contact us is by phone. Pick up the phone. You're going to get a member of our care team on the other end of the line. Excuse me. And they are going to ask you about what's going on, right? So we call that the chief complaint. So we're going to look at that chief complaint. We're going to talk about what's happening, why you need our services. We want to make sure that it's an appropriate visit for our teams. We want to make sure that it's not time sensitive or life threatening. So we're going to walk you through all of your information, who you are, where you live. We're going to get your insurance information because our visits are covered under mostly all insurances in the Phoenix market. So we're going to bill your insurance for our visit. And so we're going to capture all that information, and then we're going to start to talk to you about, why you need us to come and see you. So it might take you maybe about 10 minutes to go through this conversation with our care team, but just remember they're being very thorough. They want to make sure that this visit is appropriate, that you don't need to go to the emergency room. And that's really what we're here for, is to keep you out of the emergency rooms, to stop you from calling 911 when it's not necessary. So you're having this conversation, and they're looking at a platform that was designed by an ER physician. So it's very thorough. So when there's a couple of different scenarios that could happen. So when they're finished, they're going to go ahead and make your appointment, and they're going to give you an estimated time of arrival for your team. And then it may be that they want to dig a little bit deeper into what's happening with you. So they may get on the phone with a nurse practitioner, an advanced practitioner, or an ER doctor to discuss what's going on, because there are always things, we get on scene a lot of times and things are more emergent than you knew, right? And then there are times when you'll be on the phone with the care team and they're going to say to you, based on this conversation that we're having, you need to go to the ER, right? So something important about what we do not transport anyone. We are not an ambulance. We are a mobile urgent care provider. We're not home health. We're not primary care. We are a mobile urgent care provider. So really our goal is to keep you safe in your home, and well in your home, and keep you away from lights and sirens and fire trucks and 911. So the most important thing that you can remember is if you think this is something urgent and you feel like maybe you need to go to the emergency room, I would say call us first. Before you pick up the phone and call 911, call us first, talk to us, let's see if this is an appropriate visit for us.
Wow. Well, you have done this 1,000 times. So nice.
I have.
Nice.
And I love to talk
job.
about it because we actually had an office right there on your campus for about 2 years. We were there on site, and it was just a wonderful place to be. So we've met a lot of your residents already, and we've seen a lot. We see a lot of residents every week. We're usually there a couple times a week. But I just think that people are very grateful that they don't have to leave their home. They don't have to leave their home and be exposed, right? We know that's a concern for everyone right now. Our teams practice really strict infection protocol. So we're wiping down our vehicles. We are wiping down everything we bring on site with us before and after every visit. Our teams are in full PPE, and what that means is they have an N95 mask, they have shoe boots and bouffants and gloves and gowns. So they do not want to be a vector, and we're very, very cognizant of the fact that, you know, we have to maintain strict protocol to come in and out of people's residences. So it just becomes a very safe and convenient really safe and convenient service outside of calling 911. And I can't say that enough. We need to remember that our first responders should be responding to things like car accidents and, you know, things that are truly emergencies. We can do things, we can stabilize a minor fracture. We can stitch, staple, and glue. We had a lady call us because she cut her leg on the dishwasher. We came and stitched her right there on site. She didn't even have to leave her home, right? We can treat UTIs, COPD exacerbation, CHF exacerbation, pneumonia. We have a migraine protocol. We will come out and hydrate, but it has to be clinically indicated and medically necessary. So if you think you're dehydrated, but you can still drink water, probably not a good time to call us, right? So some of those things. We are also COVID testing. We are doing rapid COVID testing for symptomatic patients. So if you have COVID symptoms, we will come and test you and give you a rapid test. If you are not symptomatic but want a COVID test, we will use a nasal swab and we will test you right there on site. Results are coming back in about 3 days.
Gotcha. Okay.
Wow. Okay. So I think she answered all of our questions.
We had a lot, and I keep checking them off.
Okay.
That's really good.
Okay, but you know, there's a couple more things. So people always ask us, well, how long does it take you to get there? Right?
That's on the list.
So really think of us as an on-demand service. So it all depends on the day. How busy we are on any given day depends on how quickly we're there. We're not sitting waiting for you to call. We are out seeing patients. So we are open 7 days a week, 365 days a year, 8 a.m. to 10 p.m. So remember, that's all holidays, 7 days a week, 360. That means the weekends too. So please call us on the weekend. Don't go to the ER. Call us. We'll come and see you. So time to scene, typically about 2 to 3 hours, depending on how busy we are. We get a little bit slower in the summer. But what's most important is we spend on average 50 minutes inside your home with you. So we're looking at really what's happening in your home. What do you need? We're looking at your medications. We're looking at, is there possibly a fall risk in your home? Do you have food insecurity? Do you need more food? Have you not been able to go out to the grocery store? We're looking at all of those things. We believe in a really holistic, whole person approach. So our providers are there on scene with you for a very long time to be able to get to know what's really happening with you. So it's not like seeing a primary care physician where you might have 15 minutes, right? Or being in the urgent care where you might have 15 minutes. We are on scene, and we know this because we look at our data about on scene and about the results that we get. So on scene average 50 minutes with our patients, and we have We take a survey at the end of each visit. It's called an NPS score. And our NPS score is typically about 99 out of 100. So that means we have really high patient satisfaction, both with our providers and with our service.
Okay, so I do know, Rebecca, that you guys have an app. And so...
We do. We do. We have a mobile app.
Right. Give us the phone number, then tell us the app, and tell us what you would suggest the best way to get a hold of you. The app, calling,
so,
what?
Yes, the app is actually, excuse me, going to feed right back into the care team, which is where your phone call is coming. The number is 480-493-3444. So you're going to actually call that number, and you're going to get a recording, and you might be on hold for a few moments, but that is the care team. The app is going to lead you to the care team as well, as will the website, right?
Right.
So you're gonna place that request in the mobile app, dispatchhealth.com. We'll move you towards that, and then that app is going to move you into our care team, because we always have to do that front end. All those, we call it a risk stratification. So we have to do that on the front end to make sure that it's an appropriate visit for our teams to see.
Absolutely.
Perfect.
Well,
It's not that you pick up the phone and we just come. It's really important that we know what your needs truly are.
yeah, that due diligence has to be met so that you guys can securely and safely know what you're getting into.
Right.
I think that's a big piece of it, is knowing before you get here what kind of situation you're coming on to see.
Right.
I appreciate your time. I know this was a quick 15 minutes. It was like,
wow,
you got through all of our questions. I think my takeaway is, in as a campus, we're trying to really keep our people obviously on campus and safe. And the idea of leaving campus to go to urgent care or leaving to go to a hospital, that again is unwarranted or maybe unnecessary,
right,
from a COVID standpoint of staying safe. And so I think this is a great option, and we appreciate all your time and your information for our residents.
Thanks, Rebecca.
Please call us.
Absolutely.
Thanks, everyone. Have a great day.
Thank you.
You too.
Bye.
Bye.
We are so excited to
Yes.
have another segment of our Resident of Inspiration. And last week, Betty Sidney gave a lot of love to this individual.
Yes.
Ida Mae Bradbury was one that when we asked her who she wanted to nominate, she didn't even pause. It wasn't even a question. It was an immediate response. So, Ida, you're with us down there in the university room. We're talking to you remotely through Zoom. How are you doing?
Oh, excellent. It's excellent. It's a beautiful day out there.
It is a beautiful day out
And your
there.
garden is always beautiful. I love walking by your house.
Oh, that makes me very happy to have my garden out there.
I understand.
I
We
didn't
both
have that.
understand
I
that.
lost.
We love your garden.
Yeah.
It's the talking point of so many people, that what you've created out there with that raised planter bed and the American flag, and you planted some new trees out front. I mean, your place looks amazing.
It does.
Well, I plan on living here for a very long time, and I've always known I was going to come to Glencroft. I used to come when you had big rummage sales out in the little parking lot.
Right.
I always talked to the residents and to the staff, and everybody seemed to be happy. And then my kids are of an age, they like to travel, start traveling, and they worried about me where I was living in my home for 58 years, and they didn't feel like it was a safe situation anymore. So I said, well, then I'm going to Glencroft.
Wow.
And they were very happy.
Well,
That
we're
is so-
glad you did.
Yeah, absolutely. So where were you living prior to Glencroft? Where were you at?
Okay, I lived down on 35th Avenue Grand and Indian School Road.
Okay.
And a lot of changes. I had a lot of wonderful neighbors, but there were a lot of renters, and I never felt safe there. But my kids felt like the neighborhood was changing a lot, and Mom should be someplace where they didn't have to worry about her. So here I am.
I understand that.
And they should still be worried.
So just one quick question. Where did your kids go to high school? Were they at... What
My kids went to Alhambra High School.
Okay, right.
And I graduated from Glendale High School. I
Wow.
I let my husband chase me until he caught me, or I chased him until he caught me and brought me back to Arizona because I was born here. And I met him in California. He was a family friend of my brother's and good-looking Navy man. So there you go. He was my ticket back here to Arizona.
Oh, that's a good story.
Yeah. So how long have you been at Glencroft
Yes.
now? When did you make the move?
It's 2 years ago, March. So this is my anniversary month.
Wow.
Wow.
That's
Nice. Happy
fantastic.
anniversary.
So we asked, before we get into your nomination, we always ask our guests about COVID and your experience and kind of the silver lining of COVID and working through that, personally with your family and your logistics of how you do life. What is the silver lining you have coming out of this back into COVID?
I think it's the same as going in. There are some things in life that you can't worry about, so you don't spend time doing that. You take the precautions that are necessary for the situations that you're in. You try to be kind to everybody and just be glad you have each day. And it's always good here at Glencroft because I know things are taken care of. You've done a super good job. And when I go out, I make sure I wear a double mask when I go to the grocery store or wherever. Of course, you miss having big family get-togethers because you can't do that now. So the holidays were rough. But we're all still here, most of us. And that's just how it is. We're glad we're head up, feet down. It's a good day.
Yeah.
That's really great advice. Now, have you gotten the vaccine?
I got my first one, and I get the second one on the 10th.
That's great.
Oh, well, the good news is when we get to 75% of residents vaccinated, we can open the campus. So I am hoping anybody who hasn't done it yet is going to do it because you just feel better knowing that you're a little safer and that you did your part. And I agree, we still have to wear masks and we do have to be careful, but thank you for doing that. And I hope you spread the word so we get, it would be great to get all the residents.
Well, I've talked to people. A lot of people have resistance because they feel like it's not been out long enough to know the long-term effects. But I figure I'm old enough, I'll just deal with whatever it is, and hopefully it will help others if I get the vaccination.
Yeah. That's
Well,
a great
I mean,
attitude.
and we think about the polio vaccine. We didn't have the global information that we have now. And boy, what if we hadn't taken that, right? So I think there is enough science behind it. And what we've heard is they studied it they studied it quicker, but they did it more intensely, and they did it with more, I don't know what the word is, but more people, more study than they had most other vaccines because they were in a time crunch. So I don't know. I think the overall report has been a good one. So
Now, Ida, going back to your nomination,
I'm not concerned about it.
What was your thought when Betty nominated you and you knew that you had to come on the show with us and take your part and keep the train moving? What was your original thought?
My original thought was, I don't know that there's one single person that I could nominate. I can nominate just about everybody in Court 6. They all have a story. B, Annie are our court reps, and their first person that interacted with me. Wonderful ladies. They're both teachers. B is a gardener like I am. She taught in a very challenging school district. Annie is a teacher, and she went to Washington, D.C. twice with a wonderful, she won state recognition as a teacher.
wow.
Then you've got Bob and Bernice, and they were on the reservation. They fostered over 30 kids. You've got, there were so many.
Yeah.
I just think you need to interview every single one of them.
Well,
Lois Ford worked at the school down, I don't know, I'm terrible at directions, 75th Avenue. Jim, my neighbor, is just a superman. And when I first moved in the first Pinewood Derby, he came over and helped me with my little great-granddaughters, and they did a Pinewood car, each of them. And he is an absolutely fantastic woodworker. He made some ship models that are just beautiful. They're works of art almost. We got a gentleman, I'm not sure what his name is. He rides a motorcycle.
Oh,
He's on that big hog, and he does beautiful leather working and tooling. He would be marvelous. So I don't think you could go wrong with anybody in Court 6.
yeah, well,
You
that's...
just got to get them all.
I bet we will.
We'll just nominate
But
all of Court 6.
before we put you on the hook to nominate one, we're going to force your hand to give us one name.
Oh.
Before I go there, I want to
Oh,
know, are you upset at Betty Sidney about putting you on the spot here, or were you blown away by that nomination? What were your thoughts when she did that?
I was really surprised because I haven't done anything outstanding at all.
Oh, well,
I like people.
That's
we have
not true.
beautiful people here. So I just try and be nice to everybody.
Well, that's a great mindset.
wow,
What
we
can I-
need more of that in the world. So thank you.
Well, that's what my mother always said. She says, enjoy what you have today because you don't know if it'll get any better. Never judge another person till you walked a mile in their shoes.
Yes.
And God doesn't make junk. Everybody,
Oh.
whether they agree with you or not,
There's another
we are
t-shirt.
good people.
Another T-shirt.
Yeah.
God
boy, little
does
wisdom,
not make
little chunks
junk.
of wisdom.
Yeah.
All right, we've got a few minutes. It's the time. We're going to put you on the hook. You got to give us one name that's going to be probably in studio with us next week. Who's it going to be?
Well, you know what? I'm going to say Bob and Bernice because of their commitment to fostering the most vulnerable of
Yes.
our population. That takes very loving hearts to do that kind of a thing. So I think I would nominate them.
Wow.
Not just like anybody else.
No,
They
of
could
course.
nominate somebody
And
afterwards.
that's what's been so fun about this segment is we do get a name from everybody, but we get about 10 or 12 ideas and then we pick one. But it's been fun to see this segment go around campus, but I could see it stay in your court for a while because you've got
gosh.
some great people right there.
Yes.
Oh, yeah, they're wonderful people there. I can't say anything bad about any of them.
Oh.
Well, and I've seen
Bernice
that.
also a gardener, and she shares plants and seeds with me. All of us gardeners like to do that.
That's super cool.
I've seen the guy with the motorcycle in my neighborhood.
Really?
Yes. Have you seen it?
No.
Oh, you would know. If you've seen it once, you would know it anywhere. Okay.
And you've seen it in your
yeah.
neighborhood.
In my neighborhood. Well,
Yeah, he has
not like
best for
neighborhood
life to get there on the road with that big hog.
Yes. Yes.
Oh my gosh.
Okay.
Well, it's been great having you on the show. I think you're hopefully going to be our last resident of inspiration via Zoom. We're
Yes.
kind of all getting back to somewhat normalcy, and we're going to be able to get back in the studio. But we appreciate you working through technology and being on this segment today.
Thank you for being you.
It was a pleasure.
All right.
Glencroft is a great place to be.
Yeah. Great words.
With people like you in it, we would agree. Thank you.
Well, there's a lot of them like me, just nice people.
Awesome.
Really nice people.
Good. Well, we thank you again.
Yes.
Okay, what a show.
What a show.
Oh, I love everything about what this just was. Great
Oh.
insight, dispatch, coming on, keeping
Right.
everybody safe.
Right?
Options. I think that's what, at the end of the day, you want options in your health care.
Well, and nobody wants to go to the hospital
No,
if they don't have to.
that's
or
right.
urgent care. So
Stay in your own room.
it is, and you know what? Nobody's unhappy with
Dispatch Health, yeah. So you
was
got
gonna say
apps, you got their
Discount
phone
Tire,
number. If you need their contact information again, reach out. We got it.
Yep.
But another great resident of inspiration.
Oh, can we nominate an entire court?
I would love that. We basically have done it before.
That would be so fun.
It would be fun when you think outside the box. But she was great. We got another great nomination. This was a great show. On the way out, we want to leave you at one thing. Vaccines, vaccines, vaccines. We got to get to that number.
Yes.
We really want to open this campus.
Well, and we're at 64.
We're so close.
So see, that's just
If
another.
you've had it and you will do it, talk to your neighbor. You know, I think we need to all encourage each other
Yes.
to take that next step. And that's how we move forward.
I mean, look at us. We're fine, and we
Yeah,
did
yeah.
both. Like, we're normal.
We are, well, I don't know about
Well.
that, but
I'm normal. Okay.
thank you very much. See you guys next week.
Bye.